Hello friends, today we will discuss about compound fracture. Compound fracture is a fracture where the skin is also involved. Mostly the skin is broken by the broken piece of bone which pierces through the skin. As the skin is pierced, there is a high chance of infection. So while treating this compound fracture, we have to clean the dirt first, then stabilize the bleeding, and then we have to stabilize the bone. There are a number of classifications used for compound fracture. The most important one is the Gesteler and Anderson classification. Gesteler and Anderson classification is based on the size of wound, soft tissue damage, periosteal stripping, and the vascular injury. It is basically classified into three groups: type 1, type 2, and type 3. Type 1 and 2 are low grade with minimal contamination, whereas type 3 is high grade with high contamination. In type 1 fracture, the wound is less than 1 cm and the contamination is very minimal. Whereas in type 2 fracture, the wound is between 1 to 10 cm and there will be moderate contamination. Type 3 Gesteler and Anderson classification is further divided into three. First one is type 3A. Here there will be extensive soft tissue damage, but there is no need for soft tissue coverage. Whereas in type 3B, there will be extensive soft tissue injury with periosteal stripping, so it requires soft tissue coverage. Whereas type 3C Gesteler Anderson classification is presented with vascular injury, which requires adequate repairing. Treatment of compound fracture includes cleaning the wound carefully. We have to give injection TT to prevent tetanus. We have to give adequate antibiotics that covers gram-positive organism, gram-negative organism, and anaerobic organism. Usually we use local antibiotics like PMMA beads. The necrosed part of the soft tissue should be debrided and the bony injury should be dealt with bone fixation. Usually we prefer external fixation for compound fracture, but in low grade injury we can go with internal fixation also. Thank you very much. Please answer this question. A compound fracture is option A, fracture with involvement of artery, option B, fracture with involvement of vein, option C, fracture with involvement of nerve, option D, fracture with involvement of skin. Yeah, that's it guys. Thank you very much.